Almost 500 million people in the world have had COVID, including about 3.5 million in Canada and 80 million in the US. And many of these people have been left with long-term symptoms called long COVID. So what do we know about this new condition? Let's get into it. Early in the pandemic, people who got COVID started noticing that many of their symptoms didn't go away after the initial infection. These people called themselves long haulers. They started sharing their experiences on social media, and they invented a hashtag called long COVID. And because these people made their voices heard, scientists started studying the problem, and long COVID is now a scientifically recognized disease. Long COVID is defined by symptoms that persist for more than 4 weeks after the initial COVID infection, or that start after the infection and linger beyond 4 weeks. People with long COVID can report symptoms for weeks or months, and in some cases, over a year. We now have many studies of long COVID, and the proportion of people who can develop this varies anywhere from 1 in 10 to 1 in 3 patients who got infected. And even kids can get long COVID. It happens less often than in adults, but it can happen, and we're still learning more about it. What's important here is that although long COVID appears to be more common in people who were very sick and got hospitalized, it's also often seen in people who had mild infections. And people report a very wide variety of symptoms. Just like the acute infection, the long-term effects can involve almost any organ system in the body, from the brain to the heart, the lungs, the gastrointestinal system, the muscles, and others. And those symptoms can be mild or they can be debilitating. For example, people often lose their sense of smell and even their ability to taste during the COVID episode. And many of my patients tell me that they still can't taste their coffee for months after their COVID is over. Other common symptoms can be general things like fatigue and muscle aches or weakness. They can also be respiratory symptoms like shortness of breath, chest tightness, and chest pain, or neurologic symptoms like headaches, or symptoms of anxiety and depression. People also report something called brain fog, which affects concentration and memory.